And I had some topics today. I had Charlotte had sent me a message earlier. I was going to cover some of these things. Um, Talking about, I had a client asking to hear about hormone therapy in the hormone happy hour, talking about things like methylene blue, role of B vitamin supplementation, metabolic diseases, signs of how you know that is affecting you. So that's a pretty cool topic. I wanted to start with potentially metabolic disorder and what that entails. Um, I think of metabolic disorder as impacting your total metabolism. Things that are included in there would be blood sugar is probably the biggest thing. I would say specifically here in North America, probably globally having instability with your glucose. So that could be periods where it's really elevated, and then eating something and then crashing. Uh, Other things that could be associated with that is high levels of insulin. Most people don't look at insulin. If you've done any diagnostics with us, we check fasting insulin. So those are two start pieces. Really, we look at fasting glucose. I think the reference range for LabCorp goes up to like a 98, all the way from 77 to like 98. I really like fasting sugars in the morning. Say if you're 12 hours without food, maybe somewhere high 80s, low 90s. Next would be like a hemoglobin A1C, which is an estimation of your blood sugar over 90 days. And that's going to include with food, without food, while you're sleeping. That is something that is used globally to get that estimation. And then your fasting insulin, um, that range is pretty vast. It goes from like 2 to 24. So if we think about like optimal ranges, in my opinion, maybe less than 8, hemoglobin A1C. I like it on the lower end. I think prediabetes starts around 5.7. I think dysfunction happens around 5.5. Um, Next piece would be cholesterol. So if we're looking at metabolic processes, you know, I think 70% of your cholesterol is made in your liver. We can get about 30% from food. The cholesterol is going to be made up of a total cholesterol. You have your high density lipids, your low density lipids, your very low density lipids, and then triglycerides, which are a little different. I would say, cholesterol is neither good nor bad. It depends on particle counts but really, I would say you'd want to be in range with most of those things. How those things could be impacting you, if you notice that blood sugar irregularities, I would say gaining weight or not the inability to lose weight. So if glucose and insulin are elevated, someone maybe have a hard time mobilizing and burning body fat. Insulin is a pro-storage hormone. Same with blood sugar. When it's elevated, it can create inflammation. That in conjunction with high cholesterol, and that's how we get something called metabolic syndrome. You pair that with a larger waist circumference, and that's a recipe for several disease states. So I would say those are some of the pieces I think about with metabolic disease and potentially how they could be impacting you. Coaches, do y'all have any inputs or anything that I missed? And then we maybe can go into some of the other questions about vitamins and supplementation.
I have a quick question. So, or what are the simplest tactics someone could use to like they could do in their own time to say, oh, my blood sugars are off. What are the thing? I always say a CGM monitor. Like get one and try it for a month. Is there other ones outside of that that you like to use
I
for
really
metabolic
like
health?
I like the CGM. They're just expensive.
Mm-hmm.
I think that even a glucometer. Now, I know probably half of you here don't want to poke yourself with a needle and put it on a stick, but that's probably the cheapest. You can get one at Walmart for 20 bucks. The strips are probably another 20 bucks. Check your sugars in the morning, see what that looks like. See if you have elevations. Other places would be after you consume food, about 2 hours, seeing if you are still fairly elevated. I could be wrong here, but I think like postprandial, so after you eat, you should be less than like 120 nanograms per deciliter, 120 grams per liter. I don't remember the specific, but you should see a drop in blood sugar. So say you eat something 2 hours later, if it's high, say 150, you could check it another hour later. If it has not come down, that's a good telltale sign that you're probably having some metabolic dysfunction. Um, those are probably my two favorite times to check, but also for people who may have reactive hypoglycemia, and this may ring a bell. So if you eat a meal of carbohydrates or you exercise really hard and then you feel weak, shaky, dizzy, lightheaded, sweaty, your blood sugar may go up. Insulin raises to counter that, and then it crashes your blood sugar. So those are things that I tell people to look out for. And then really easy ways to check that. To my knowledge, there's not a way to check an insulin at home. I believe you can only do that through blood serum. To answer your question, Charlotte, what else? What else am I missing, or what else can we add there?
Oh, maybe we could do blood pressure, about your own blood pressure thing. Simple.
Yeah, yeah. I think blood pressure is also a big piece. I would say that blood pressure issues probably are more prevalent in men than women, but postmenopausal women could most definitely have some issues with blood pressure if you have a loss of estrogen. Last week, I was showing some studies, and I had posted them here in the chat, talking about endothelial function and how estrogen supports the vascular basically the elasticity of your veins. So as your veins pump blood, they kind of come up and down like a hose. As you have inflammation, loss of estrogen, uh, plaque or calcium buildup, those veins can get really hard. So checking blood pressure at home. I'm sure all of us have been to the doctor and had high blood pressure, maybe. I know I do. I have something called white coat syndrome. I hate going to the doctor and they'll put that cuff on me and my blood pressure is, 10, 15 points higher than what it should be. And what I personally do is I'll check my blood pressure at the house right when I first wake up. I'll do it over 7 days and then I'll get an average of that versus, one off kind of getting a total number of what that looks like. Things that I would consider with blood pressure: sitting still, not talking to anybody, not crossing your legs. I usually will sit on my recliner before my children are awake because they sometimes can raise my blood pressure, and I put my cuff on my arm and I'll check it. I tend to do that most Fridays. But blood pressure is definitely a silent killer. So it's something we do want to be aware of. Um, Plenty of things to do to manage blood pressure. Maybe after we talk about some of these at-home remedies, we could look at some things to help manage blood sugar, help manage blood pressure. So yeah, I would say those pieces are important. I'm trying to think about other diagnostics at home that are helpful. Probably those. We're talking maybe stabilizing blood sugar, things that I think a lot about. Having balanced meals is probably up at the top. So fats, protein, fiber, those things are going to help that blood sugar response. So I don't recommend, having crackers or a sole carbohydrate for a meal. You being able to have a combination of macronutrients is going to be very helpful to regulate blood sugar. And I would say test it if somebody is curious on what that response looks like. Have a solely carbohydrate meal, check your blood sugar 2 hours after you eat, and then have a combination of food and check your blood pressure 2 hours after you eat. The other interesting piece that I see with like CGMs, sometimes people may eat what they think are glycemic friendly foods and have an elevation to blood sugar. Charlotte, do you use a CGM or have you used one in the past?
I have used it, and I actually realized I was kind of reactive hypoglycemic if I went too long, and I didn't realize I was like that. So that was kind of interesting. And I think I was doing carnivore at that point. So again, it was a very isolated scenario, and maybe my liver wasn't doing its job, obviously. It was heavily taxed. So yeah, I think everyone could do it for at least 4 to 8 weeks. I think it's just really telling, and so you can see what kind of foods you react to, what your blood sugars do at night, and it's awesome. It is expensive. It's not cheap, unfortunately, but I guess I look at it as an investment into your health, like anything else. Like just see, $400, you can't go wrong. Definitely.
Yeah, have you ever eaten any foods that you thought maybe shouldn't spike your blood sugar and then you wind up having a huge elevation in blood sugar?
Mm, I don't think I had huge spikes. What I didn't realize, oh, well, I think I ate an apple once and I'm like, oh, my blood sugar went lower. I don't know, it was like weird. I often found that my blood sugars went lower in certain isolated events. I'm like, this doesn't make any sense. Why is my blood sugar doing this? So I kind of had the opposite effect. Because but then my blood sugars were definitely higher in the morning, always, even after waking up, like always sitting at between 90 and 100 for a long time. So.
Yeah, that's interesting. I was consulting with one of our clients last week, and she was wearing a CGM, and she was eating things like sweet potato, and she thought she would have a better glycemic response, and her blood sugar was actually quite high on that versus some fruits were less, she was less responsive, and you would think something that has a lot less carb or a lot less fiber, you would have maybe a higher response in blood sugar, but she was actually having less of a response versus something like a sweet potato, which is, people think of as a complex carb. So I would say it's very person dependent. And there are no rules with nutrition of like what works for you, what works for anybody here. We're all going to have different like biological makeups and how our body responds to food. So I think that's really where having a coach and being able to fine tune that process with somebody, especially with social media, there's so much information out there. Do this diet, do that diet, eat this, don't eat that. And really, what makes all of this unique is we're all going to respond to things differently. So really listening to your body, and then you can use those tools to track those metrics.
Justin, I was going to agree with you. I literally was going to say that. I was like, that is why people, I think a lot of everyone here can say there's so much information out there, like which diet is the best. And I always say, see for yourself, know for yourself. Invest in the tools, try it on yourself, obviously within reason, nothing to kill yourself, right? But like, you got to be careful. But the best way is to do something for yourself and really empower yourself. Because I feel like a lot of people, we've given our power away. Like, I need someone else to tell me. Like, there's a balance there, right? But I think that there's so many things that we can do that will make us feel more empowered with our health and the CGM, the blood pressure, trying a diet and actually carrying it out as long as it's not, detrimental. Read the signs. Try it out. Know for yourself. I think, don't be scared. And that's something that's really freed me in the long term of like, how much do I know my body? You just connect with your body so much better and you read the signs so much better.
Yeah, no, I agree with that. And, historically, I've always liked a higher fat diet for myself. I feel like I just feel better. I like some carbohydrates, but as an athlete growing up, I ate a very high carbohydrate, low fat diet. And that tend to cause more issues for me the older I got. So I also think that you want to look at your health in decades. What works for you in your 20s is not going to work for you in your 30s versus 40s, 50s, 60s. It's an evolution. Um, so just really being aware of that, not being set on a single thing. I think the trends right now, I see a lot of like carnivore or animal-based diets. I like those things. I think they can serve a purpose, but um, I don't really fall in any specific camp. It's just what you need for that time. Um, Things to help maybe regulate blood pressure. Things I would start with is maybe regulating stress is probably one of the biggest pieces. Easier said than done. Whatever that is to that individual, if is meditation or prayer, time outside, grounding, sun exposure, um, that usually seems to be one of the initial things I like to work with people on is regulating stress. Next, in my opinion, would be hydration. You need minerals. I think a lot of people are terrified of using salt. So getting adequate amounts of sodium in your diet. You need potassium and magnesium and all of those other minerals, but I think that most people are in this dogma of low sodium, but sodium's needed to help with muscle contractions, heart contractions. Sodium is also needed with water to move carbohydrates appropriately. So I'd say balancing minerals is a really big piece. Getting adequate amounts of water, and then sleep. I'm pretty sure there's some clinical data on lack of sleep and elevations to blood pressure. So I would say most people at a minimum need 6 hours of sleep. I need about 8.5 hours of sleep. That's just me personally. I don't do well on less than that. And I do notice some differences in my blood pressure. I am predisposed to hypertension, and I have to be pretty careful with that. So sleep is a big piece for me to manage that. Um, Am I missing anything else there that you would add in on blood pressure? Any of the coaches? I just want to make sure I'm not skipping over anything.
Well, I like to do heart rate too for myself because I'm really in tune with where my heart rate's at. It's usually at a solid 60s, but I can really tell if I'm in my 70s. I'm like, oh, I hear my heartbeat, I feel it higher. Now, that could be stress, it could be anxiety. I mean, nothing is actually wrong, but I do like to monitor that with blood pressure to
I
make sure like I'm mostly staying within my realm 80% of the time and then assess stress. But sometimes even with detoxing, you get to know your body really good and what its signs are of like, okay, this is a Herx reaction, my heart's higher, my blood pressure's a little high, you start to really get in touch with that. So I do think the heart rate is good as a kind of a marker of resting. And then kind of like, oh, is it a food reaction? Is it a histamine reaction? Is it an anxiety? If your heart's continually high or high at night, is my body struggling to detox at night? You wake up with a higher heart rate. Is it my thyroid, with a higher or lower resting heart rate? So I think that can be kind of good too. It's a little bit broad, but I use it
yeah,
anyway.
I like it. I'd be curious if anybody would like drop in the chat what your favorite wearable or things you use to track. I use an Aura ring. I've used an Aura ring for about 5 years. I like it because it'll pull my HRV. It'll give me a readiness score. I think that's another big piece if we're looking at managing stress. Exercise is a stressor. So if you're already buried from a day's or week's worth of work and family and life, you doing a really hard workout on top of that may not be beneficial to you. So you being able to look at a readiness score and HRV, resting heart rate, that'll kind of prepare you as like, hey, is this a restorative day for me? Or can I go smash legs? Because I like to do that. But sometimes I know I need to foam roll, maybe sit in the sauna and decompress. So Aura's always been good to me. I think Apple Watch has upgraded pretty significantly over the years. Whoop is pretty popular. Charlotte, do you have a specific do you use any type of wearable or do you just check it maybe from a blood pressure cuff? I know EMF's the thing and not everybody wants a wearable, but I like data. So this is my EMF device, I guess.
Yeah, I think hit the nail on the head. I'm trying to reduce the amount of stuff I wear, but yes, I wear AirPods, so I'm not 100% clean, but uh yeah, you can do that, but I usually just put my hands here and just do it the old-fashioned way. And now that I've done it so many times, I can tell when it's 60 because I do it so often. I'm like, okay, I'm good. So, to each their
Yeah,
own, whatever you
a-
like.
absolutely. Claudia, yeah, Apple Watch. I would get in there and play with those settings. I'm pretty sure depending on the generation, it's probably got the ability to track all of that information. And the sleep component's really helpful. I think that for me, I probably I'll look at my steps, but really tracking my deep and my REM sleep.
Yeah, I'll do that. I think I tried to sleep once and then just got tired of wearing it at night and then never did it ever again. But yeah, there's a lot of features. I just don't go in and play and figure it out. So I will definitely do that.
Yeah, I think that. the Apple Watch on the wrist at night could be difficult for sure. I'm not a watch guy. I always break the face because I'll hit it on things. So I like the ring, but I think they're all pretty good tools. Um, let's go into your this next question here. The role of B vitamins in supplementation. Um, the things I think about with B vitamins, you have a couple forms of B vitamins. So you have synthetic B vitamins, and then you have methylated vitamins. So if you've ever done a lab review with me and I recommended B vitamins, probably homocysteine supreme or methyl guard by Thorne. Those tend to be my favorites. B vitamins are going to help with detoxification to a degree. So they help reduce something called homocysteine. We check it in blood work. So if any of you have done labs, you can go pull your homocysteine. If it was elevated, I probably recommended using some supplementation. Homocysteine is a intermediary toxic metabolite. So it builds up in the blood. And when you have too much of it, your body is losing the ability to reduce it and make glutathione. We talk about a lot about detox here on this channel, and the body's ability to make glutathione is one of your master antioxidants. So if that homocysteine is elevated, our body is potentially more at risk for inflammation, and will potentially have issues clearing things like environmental toxins, hormones, neurotransmitters like epinephrine and norepinephrine, so your adrenaline hormones. So B vitamins are pretty important. Bees are also going to help be cofactors to making red blood cells. I'm sure at least one lady on this call has had issues with anemia in their life. Looking at bees is a good way to, like, it's not the end all be all for anemia, but it can be beneficial to help produce more red blood cells. And I'm pretty sure bees, I'm going to ask Ashley this, have some impact on the digestive tract. I don't know if they feed some specific microbiota, but I thought I read something about that and I found really interesting. Am I right there, Ashley?
Sorry, sometimes getting to the mute button takes a second. Um, yeah, so yeah, they absolutely they influence, well, I mean, obviously a lot of things, but they influence a lot about how vitamins are produced but absorbed. So they also a lot of B vitamins are cofactors for certain enzymes that help your microbiome grow and function optimally. They help balance like a lot of that butyrate or the butyrate producing bacteria, which is anti-inflammatory. Butyrate's really good for the colon epithelial cells. They can also help certain specific pathogenic strains that it can influence that and like suppress some of that. B vitamins are really good for immune function. So yeah, lot of things there that can be influenced, especially in terms of like dysbiosis and leaky gut and stuff like that. So just optimizing the proper amount of that. And also, I mean, this is a silly overarching thing, but also, I mean, if you're getting enough things in your diet, you're in the variety of things, then hopefully you're getting enough. So just like another push for making sure you're getting good variety and lots of different like fiber things that help with the B vitamins and microbiota.
Ooh, that once I want to go once you go a little bit further, can you talk about hyperchlorhydria and maybe the inability to get B vitamins from protein? Because I see that sometimes.
Yeah. Well, I would say it's interesting how many people have hyperchlorhydria in general. And so, and especially, so, I mean, what I see a lot, obviously, in the GI map it is with H. pylori specifically. But because it often, well, H. pylori or elastase, both of those influence that, just like stomach acid specifically. And so a lot of times, I see a lot of people who've been taking PPIs or like downing Tums or just like, oh, this is a part of like how I eat. And they're getting that reflux sort of thing. So that hypochlorhydria is lowering the stomach acid. A lot of times people think it's too much acid when it actually might be low stomach acid, which feels very similar actually. And so, yeah, low stomach acid is going to inhibit that B vitamin absorption. So you're not going to be able to absorb a lot of that. And so then you're not going to have that availability to help. And so, yeah, other things. So obviously, I mean, I mentioned, what did I just mention? H. pylori, H. pylori and elastase, but other things too, like there's other things that influence hyperchondria. So Hashimoto's can influence it, other autoimmune things, stress can influence it and stuff like that. So
Age.
you need age, yeah. You need that stomach acid to help release, for instance, like B12 from food. And so then if you're not releasing it, then it's not available to absorption. B12, I'm sure a lot of us hear that it's great for energy, but so like fatigue and your brain and obviously anemia and stuff like that. But I mean, other vitamins too, your B1 and B6, they're just not going to release and be absorbed as well when that hypochlorhydria is there. Folate, stuff like that.
Yeah, that's great. I appreciate that. I think B1's really interesting, thiamine and its ability to help regulate blood sugar. I think a lot of people don't really recognize thiamine. We always look at B12, B6, maybe riboflavin, maybe folate, but I really like B1.
And B1 actually influences the motility a lot. So that one can, be impactful in terms of constipation and stuff like that.
Interesting. Yeah. I had a question pop in here. Kim, I don't think my homocysteine levels was checked. So if you have done a Dutch or you're doing a Dutch test, what we look at is going to be an MMA, it's methylmalonic acid, and that's going to be a tissue-specific B vitamin marker. They're also going to look at a biotin and B6 marker because that's going to have a significant impact on estrogen metabolism. So Dutch will look at that if somebody is doing some specialized testing. If everybody does do our set panel coming into the program if we're doing blood work, because it is all encompassing. I always joke when I meet with somebody, it's like, why we took 8 vials of blood from you is because with your symptoms, we don't know what's going on. So we want to look at this as a process of elimination and start to scratch things out so we can pinpoint what's specifically going on. So we do have that set panel. If somebody's doing specialty testing, we're covering Bs through our Dutch test. We're also looking at that glutathione production, specifically if somebody has some sort of estrogen dominance or detoxification issue. Let's see. Other questions and supplementation. So questions around methylene blue. We had a client want to know more about that. So methylene blue is used at high doses in surgical settings. It's probably in the past 3 years been used a lot more in the functional medicine space, integrative medicine space. Methylene blue is going to help the electron transport chain in the mitochondria. I know that sounds like a pretty complex, but basically it helps with the efficiency of your mitochondria. So what it does a lot of times, and where I really like to use it, is in autoimmune disorders or low cortisol settings. Cell interaction tends to downregulate with chronic inflammation, autoimmune, low energy output, even hypothyroidism. So basically what methylene blue does is speeds up the body's ability to produce energy, which is really interesting. I've been using methylene blue off and on for a couple of years, and I really like it. I use it more as a cognitive enhancer. It really helps me kind of stay focused throughout my day. It also is going to just increase your body's ability to burn and utilize calories. And what I see a lot of times when people are coming into this program is maybe a hypometabolism setting. I don't know if coaches would agree with me on that, but I see more times than not, women are under eating, and then we have underproduction of hormones on top of that. And you're eating 1,000 calories, but you're unable to lose any weight. Your body's going to regulate to that. Your cells are going to downregulate. So methylene blue is a way to kind of upregulate that. I would not overlook basic hormonal processes. Your endocrine function does support your metabolism, so you need adequate amounts of sex hormones, thyroid hormone. Say those things are dialed in and you're still having issues with energy output, methylene blue is pretty cool. It's something that could be utilized. Things to consider with that. There is quite a few things that it contraindicates with. So just good information is you can't take SSRIs with it, MAO inhibitors, you can't use SNRIs, you can't use ADHD medication. So there are other alternatives outside of methylene blue. It just seems to be one of the most trending things I see on the internet right now. But say you're on one of those medications, there's 5 or 6 other peptides that work similarly on the mitochondria. SS31 is a peptide that also supports the electron transport chain. It has a lot less side effects. That would be something someone else could consider. So I think I've probably talked about this a couple times, but looking at the where we're going as far as peptide therapies and anti-aging medicine is really looking at things at a cellular level. Being able to upregulate those processes, there's speculation a lot of disease states are surrounded by low mitochondria function. So I hope that's helpful. If anybody has any questions, I can expand on those a little bit more. And I'll wait a second because I have a question here I'll read next. Okay, Kim dropped a message in here. Will you make specific supplement recommendations at lab review? I'm awaiting Dutch test results and GI map. So Ashley is your GI lady. Of course, she will make some recommendations. And that's the beauty of this is we're not going to say, hey, everybody, here's the same 10 supplements. You all take the same thing. Ashley is going to look over your GI map because she's much better at that than I am and give you very specific things for you to work on with your GI. And then if we're looking at the endocrine portion, yeah, we're going to give you very specific things based off of that testing. If we're looking at Dutch testing, could be supporting estrogen metabolism, maybe helping with preference of 5-alpha reductase, so making less dihydrotestosterone, things that can be problematic for women. Looking at cortisol and cortisol clearance gives us some ideas on how well your liver is detoxifying and processing things. So we'll give you a integrative plan based off of that lab work and then share that information with your coach. And then all of us together will help proceed with that process. So that's the first part of the question. I hope I answered that well for you, Kim. And then what are your thoughts on Tessa Moreland, 5-amino 1-MQ versus GLP-1s for weight loss, GLP-1 microdosing for weight loss? Okay, GLP-1s are like the hottest topic. They have been for a couple of years. I see them over-prescribed for most people. And this goes back to what I was talking about a minute ago. If you're eating 1,000 calories a day and you're not losing weight and you don't have blood sugar issues, a GLP-1 is just going to further reduce your appetite. The other thing I dislike about them, and I like them, but things I dislike about them, if you have any digestive issues, they can be problematic. They're going to slow down motility. You have dysbiotic bacteria, and then you slow your motility and more food is lingering in the gut. I think that probably could be a recipe for disaster. If you have low stomach acid, it's going to be even harder to break down protein. Now, say that you don't have any of those issues and you are dieting and your hormones are balanced. I think GLP-1s are okay. I've utilized them. I've used all of them: exenatide, semaglutide, trizepatide, retatrutide. I've tried them all. I think they can serve a purpose, but we really want to look at that foundational work. If we're talking about other peptides, Tessa Moreland is really cool, Kim. So what I'll say about that, it's a growth hormone secretagogue. It's very similar to growth hormone in nature. It is, I believe, the only one that has been passed through clinical trials. It was used on HIV patients with fatty liver disease. And Tessa Moreland does a really good job of mobilizing visceral fat. So if we want to reduce fat around organs or midsection, Tessa Moreland works very, very well for that. The things I don't really like about it is it's very expensive. So that would maybe disqualify some people. But if you have the means to use something like Tessa Moreland, I think it could be helpful. The other thing I really like about growth hormone peptides, and this is where my Aura Ring comes in into play here, I can see over the course of weeks using something like that, my deep and REM sleep actually pick up, maybe 20, 30 minutes on each of those cycles, which is substantial because most of our sleep is not deep and REM. If anybody's using any type of metric to track their sleep, you're probably not getting tons of deep, tons of REM. Those growth hormone secretagogues really improve your body's time in those resting periods where you're able to recover and repair. So I think it is a pretty interesting peptide. It's been around some time and there's enough clinical data to say it's pretty safe. 5-amino 1-MQ, also relatively new. That works on NMNT. So basically, it helps with shifting your body's ability to burn white adipose tissue, similar to Tessa Moreland. So it helps with visceral fat. It also helps with methylation to a degree. And you all know me. I like pictures. So let me show you this. Images. And I was showing somebody else this the other day. Let me see if I can find this. T. Okay. The other interesting thing with 5-amino 1-MQ, it's going to work off of sirtuins as well. So which you can see of that SIRT1, and it's going to help with the production of NAD. So NAD is also super popular right now. When using 5-amino 1-MQ, it does increase NAD. It helps with the conversion of SIRT1. It's going to speed up your methionine cycle, so your B vitamin cycle, and it's going to reduce white adipose tissue. My only thing with this, and yes, I've used it because I've used all of these peptides, there's not a lot of clinical data on it. So most of this is in rodent studies. But what I've seen working in clinical setting with doctors is it does work quite well. I would say most people tend to lose 5 to 7 pounds without really doing anything additional. Just with the upregulation of some of these enzymes, it really just kind of helps the body shed and burn more body fat. It also pairs really well with NAD+. So lots of information on that. I hope that answered your question. Kim, Allison recommended these. Can I message? Yeah, you can message me privately. I'd be happy to talk to you about that. I hope that was enough information on those. Charlotte, am I missing anything else? Was there anything specific? I know I briefly looked at your message. Was there anything else that we wanted to cover in regards to vitamins and supplementation, metabolic disease?
I think that's good. Yep, thank you.
Absolutely. Do any of our clients or Lisa, do you have anything for us? I wanted to make sure I'm able to answer everybody's questions.
Not today, I don't. Oh,
Not
good.
today. All right.
Thank you.
Yes, of course. Shannon, good question. Effects of menopause and Hashimoto's on LDL cholesterol. So I think a lot of times with hypothyroidism, we can see a buildup of LDL cholesterol. And hold on, because I'm just full of documents. Let me show you this. So this specific study was done on effects of thyroid hormone on lipid metabolism. And this talks more about fatty liver disease, but Fatty liver disease is an accumulation of cholesterol in the liver. Glucose to a degree, your liver is going to hold some blood sugar there. But some of the really interesting things, and I've showed this a couple times, is the liver is going to do a lot of things. Food intake, fat tissue is going to go to the liver to be burned. So as all of us are talking here right now, or you're listening, your body's doing something called beta oxidation. So we're basically burning body fat. Some of us are more efficient at that than others, depending on liver status and a whole bunch of things. But fat tissue goes into the liver and it's going to be mobilized and burnt out through beta oxidation. That happens just by breathing on a day-to-day basis. The interesting thing with cholesterol is that, let's see, the liver has a lot of thyroid receptors, so thyroid hormone, and it has a high amount of thyroid receptors, specifically thyroid receptor beta. So lipid metabolism, reports of thyroid hormone on lipid metabolism have been documented since the 19th and early 20th century. It was noted that reversible hyperlipidemia with elevations in total cholesterol and low density lipid were frequently observed with patients with hypothyroidism. So if you have low levels of T3, you're going to have a really hard time moving LDL cholesterol because thyroid hormone is going to help with the attachment to bile and or just burning, being able to burn and mobilize fat from the liver. So if you are having Hashimoto's and you are not being treated appropriately for that, and I don't know your specific situation, but if you are using a levothyroxine, you're missing part of that equation. You're not getting enough T3 most likely. I see that being a pretty big piece. So you need to upregulate your thyroid function within a physiological or normal level. That will help lower your LDLs. That's one of the first things I recommend. Also, being able to support the liver, making sure that we have enough things to move bile, and the liver is functioning appropriately. But that is going to be a piece of it. Estrogen is also going to help keep your HDLs elevated. So if you are going through menopause, what I see a lot of times is women historically have a high amount of HDL, the majority of women. So HDL is high while you have an abundance of estrogen. And then as you go through menopause and you lose a lot of that estrogen, your HDLs suppress and your LDLs pick up. So you really want to look at it from a couple point of views. You want to make sure your thyroid is in a good spot, your liver is not overburdened. You are taking appropriate medication if you have Hashimoto's, and then you want to look at are your needs being met from a hormonal standpoint. So we talked about high blood pressure earlier and endothelial function, how well your veins are moving up and down and expanding. Having adequate amounts of estrogen are going to keep your veins from getting cracks and gouges. So you need estrogen, you need thyroid hormone, you need liver detox. Those would be my areas to work on. I don't believe I've ever met you, but if you're new in the program or you're just kind of checking it out, we would look at it from that point of view. The gut is also going to play a really big role. Ashley can tell you Hashimoto's and GI issues, they can sometimes go hand in hand a lot of the time. And then Charlotte can also tell you how much the liver plays a huge role in processing and moving toxins. So we look at it from a lot of point of views. It's not just hormones. It's not just GI. It's not just detox. It's all of those things together. That would probably be my recommendations for you and how potentially we could solve that. I hope that answered your question, Shannon. I know that was pretty long, but I like to give a thorough explanation. I think we got time for one more. I say this every week. Does anybody else have one more question for us? Thank you, Lisa. See ya. All right. Gonna wait 1 more minute and then I'll let everybody go, but I want to make sure. All right, Shannon, looking forward to it. Ooh, okay, that's a good question. Did you gain water weight on peptides? Kim, so Tessa Moreland can make you gain some water weight. Okay. I would say that that's a pretty common side effect. I see a lot of both men and women. So growth hormone, most definitely can have some effects on ghrelin. That's one way we pulse more growth hormone. Ghrelin can drive up things like insulin that can make someone water retentive. If you look at the literature, they say growth hormone peptides improve insulin sensitivity. Sometimes I see that being a factor. Maybe it's something that's not always true, and some people can gain some water weight on that. If someone's really sensitive to tesamorelin, I think of Samorelin. It's like its little brother. It's less effective, but it's going to have less of that water retentive effects. So if you've used it and you're gaining water weight on it, and or if you're worried about that, I would probably test the waters with some Moreland. It's a lot cheaper. See how you do on that. If it goes well and you like it and you don't gain a bunch of water weight, you could look at using a Tessa Moreland. But sometimes that can happen. And I know if we're trying to improve body composition and reduce waistline, last thing we want to do is gain 5-6 pounds of water. So those are things that I would think about maybe using them in a strategic fashion. My recommendations, if you're exploring peptides, Kim, I'd start with mitochondrial peptides. Those are my favorite. I see most people getting the biggest bang for their buck from them, and they only improve hormone replacement therapies. So I would say looking at any of those mitopeptides, because all of your sex hormones are going to interact with the mitochondria. And if your mitochondria are slow, you can pump as much testosterone, estrogen, progesterone into them. It's not going to help with energy output. So I would start there. I hope I answered your question. Yes, absolutely. All right. So if I have no more questions, I'm going to let everybody go. I really appreciate everybody joining today. Thank you, coaches, for all your input. We will be here again next week, same time, same place. I hope everybody has a great rest of your week. Thank you.